In a shocking incident, Africa's Nigeria has incurred one of the biggest losses of vaccines. Up to 1 million COVID-19 vaccines are estimated to have expired in the country without being used. In Nigeria, Africa's most populous country and home to more than 200 million people, fewer than 4% of the adults have been fully vaccinated, while the governments of various African countries are pushing for more vaccine deliveries. The recent surge in supply has caused a new problem now. Many African countries lack the capacity to store the vaccines, most of which come with a short shelf life. According to reports, the expired shots were made by AstraZeneca and were delivered from Europe under the COVAX scheme led by the Gavi Vaccine Alliance. According to another source, the doses had arrived within 4 to 6 weeks before the expiry date, and despite ramped up efforts by the health authorities, they could not be used on time. As per Nigeria's National Primary Healthcare Development Agency spokesperson, the count of the expired doses is still underway and an official number is yet to be finalized. Meanwhile, the World Health Organization confirmed the expiry of doses but has refused to share the figures. It also said that 800,000 doses were on the risk of expiry in October that had been used. Nigeria's wastage of vaccines is so far the largest in the continent, and the numbers are higher than the total doses received by many countries in the region. However, this is not the only instance of vaccine wastage. Several countries in the European continent, including Germany and Switzerland, are struggling to use their doses. The British officials predicted a 10% wastage of vaccines in January. In April, the French health minister told the media that about 25% of the vaccines were being wasted at the time. And for more on this, we earlier spoke to our correspondent Phil Ehaza from Abuja. Take a look.
The new variant Omicron, emerging, especially affecting some countries already in Africa, and then of course outside the continent, you realize that the response so far has not been to ban or place travel bans on other countries. Rather, there's been a lot of calls for collaboration among countries to see how that they can, reduce the spread or be able to understand, first of all, the risk of this new variant. So with further updates that we've seen over time since the first detection that was announced by South Africa some weeks back, you realize that health authorities are beginning to now see that it's something they can manage. They're also trying to improve vaccination and as well booster jabs. The Nigerian government also said that they are considering looking at booster jabs. But then if you look at the fact that just about 4% have been vaccinated, that tells you that if you're looking at giving booster jabs to just the 4% of population, what happens to the other 96% that are yet to receive the jab? So it's something that African countries are collaborating at the moment, looking at also efforts from WHO and other countries.
WION now available in your country. Download the app now. Get all the news on the move.